Hello, my name is Susanne Koch. I'm from Berlin Charité and I like to present the preliminary results of the PAR-COVID study. In this study, we included COVID-19 patients who were admitted to the ICU. Our aim was to analyze if EEG signatures differ depending if patients develop ICUDelirium or not. Patients received during ICU stay every second day a frontal EEG recording with a satellite monitor during the first 2 weeks on ICU. EEG data were analyzed based on a MATLAB code and we compared the power spectrum within the different EEG frequencies bands. The ICUDelirium was assessed by the medical staff on ward with a CAM ICU, done once per shift. Overall, by now we could include 35 patients. Mean age were around 60 years. They were mainly male patients, and they didn't differ much on SAPS-2 scores depending on ICU or delirium or non-delirious patients. Sedation was done by propofol, midazolam or sevoflurane, and dosage of the sedatives didn't differ between the groups. During sedation, the RASS score was between -4 and -5. EEG during sedation did significantly differ within the beta band range, with the range between 13 and 30 Hertz. And here you see the EEG spectrogram of the ICUdelirious group, and here is the non-delirious group. And what you see is that here in the beta range, you see here a higher power compared to the delirious group. This is seen here again. The red line is the delirious group, and you see that the power is lower in the beta range, here from 13 to 30 Hertz compared to the non-delirious group. And due to the bootstrap analysis, you see that this differs significantly. During emergence of sedation, so when the sedative agent was stopped and patients still received opioids, the RASS score was between -2 and -1 in both groups. It both didn't differ. And what you see here now is that in the beta range, in the delirious group, you see a higher power compared to the non-delirious group. As you can see again down here, the delirious group is the red line, where you can see that the power is higher in the beta band range, and this is significantly different, what you can see here in these bootstrap analysis. So overall, we could show that the EEG signatures differ significantly between delirious patients and non-delirious patients. During sedation, delirious patients present with a slower EEG range or less beta band power. So it was a predominant delta and theta EEG activity in delirious patients, whereas at during emergence from sedation, they present with a higher power in the beta band range. So mainly we've proposed that patients who are at risk to develop ICUdelirium have a higher sensitivity to sedative agents. Since there's a persistent EEG activation after stopping medication with sedatives, on the other hand, during sedation, you have a slower EEG. Our data are limited since many EEGs couldn't be analyzed due to many artifacts. Thank you for listening.